Welcome back. This is the next segment in jaw pain solution. Now, I normally do acupressure, self-massage, and passive stretching. And this one is the passive stretching one, but it's going to technically be craniosacral therapy technique. And craniosacral therapy is a modality that a lot of us massage therapists use that's very light hands-on touch that helps manipulate the fascial system to release these restrictions. It will feel very subtle, so don't give up right away. It is extremely powerful modality, but it does take some practice. You're going to increase your palpation skills or your sense of touch. You doing these types of solutions for some of the ailments that you may be experiencing. I'll be doing a couple other ones in some other videos, but this one's for your jaw. And this is one my clients love. And you can do this sitting up or lying down, and it's super simple, but it's maybe not necessarily easy to learn. So pay attention, all right? So the way the jaw works is that there's these two little kind of hooks that go up and over, and that's a lot of where the pressure begins to form, because when we chew and when we clench, we are pushing this is our mandible, our lower jaw, we're pushing it up, and that's where it can kind of get stuck. So there's a lot of tension right where the mandible connects up to the upper jaw. So what we're going to do is you're just going to simply rest your hands on your cheeks, looking like the kid from Home Alone. And imagine there's suction cups on your fingertips, and I'm barely touching my skin. They're not putting really any pressure, and I'm just allowing the weight of my hands and arms to begin to pull the jaw down. And really, I'm using the superficial fascia and the superficial muscles. That means it's closer to the skin surface. I'm really connecting with those. I'm not pushing in like we did in the other modalities. I'm really staying on the top layers. And I'm also guiding my hands more at a diagonal, going like a 45-degree angle away. All right, so this is what it's going to look like. It's going to look like I'm doing nothing, but actually it's very, very powerful work. It just takes practice. So I'm relaxing my body, especially my shoulders, and sitting upright. And this is really nice to do laying down, but when you're upright, you also have gravity. And I'm just slowly really letting my fascial system, my tissues, tell me when it wants to move a little bit more southward. And then I push it a little more forward. And there's almost no resistance. Like a lot of times when we're doing massage, we feel kind of a tightening when we're starting to get into an area that's tender. With this, you don't as much, but it is subtle. Practice this particular passive stretching craniosacral technique. You could do this every day. You could do this several times a day, and the longer you do it, the better. I have worked with some clients where I am just working on their jaw for 3, 5, 6, 10 minutes. That sounds like a long time, but if you have a lot of tension there, this may be one of the softest, kindest ways to begin to release that area. And let me know if you have any questions. Okay? Thanks.